Hello, everybody. My name is Dr. Anil Sachdev, and I am speaking to you from New Vision University. I want to talk to you about the novel coronavirus. Understand there is a big difference between a virus and a bacteria. A bacteria will typically reproduce itself and then take over the host cells, but a virus will penetrate a host cell and convert that cell into a virus-producing factory. Understand that the coronavirus has multiple species, both in animals and in humans. We all have coronaviruses within our bodies and have had them for hundreds of years. They were first identified in the 1960s, and normally they are safe. You will develop a respiratory illness, which is normally benign. Now, the novel coronavirus replicates at 32 to 35 degrees C. The human body is around 36 to 38 degrees C. The coolest areas in the human body are typically the upper respiratory tract, the mouth, the nasal cavity, the pharynx, the larynx, and the upper portions of the trachea. That is why the novel coronavirus, avidly named COVID-19, starts with upper respiratory tract infections. Most of these species of the coronavirus are present in bats, not humans. They usually jump between bats and an intermediary animal. In 2002, there was a case in China where it was believed that the coronavirus had jumped from bats to the civet cat. From the civet cat, because those civet cats were being sold in markets in China along with bats for meat, it then jumped to humans. That started the SARS pandemic, which killed 780 people in 2002 to 2004. In 2012, it repeated itself and it went from bats to camels to human beings. That started in Saudi Arabia in a respiratory condition called MERS, Middle Eastern Respiratory Syndrome. That claimed over 800 lives. Now, in the year 2019 to 2020, we have the novel coronavirus. This has also been named SARS-2 or SARS-CoV-2, SARS-CoV-2. This is a condition which has killed over 40,000 people around the world. If you were to Google coronavirus symptoms, it would show you this map. This is a map that's been uploaded by Google and it is updated every 15 to 20 minutes. This map clearly outlines exactly how many countries have been affected, how many confirmed cases there are, and how many deaths have been reported per country. In the United Kingdom, as of now, we've had 2,352 deaths. The United States has had over 4,000. Italy has had over 12,000. Spain over 9,000. Iran over 2,800. This disease is spreading rapidly. Now let's talk about the symptoms. Remember, the incubation period for the coronavirus is 1 to 14 days, which means if you contract the virus, you may remain symptom-free for 14 days. But the median average time of presentation of this condition is 5.1 days. That means if you may have contracted the virus, even if you remain symptom-free after 5, 6, 7 days, does not mean you're in the clear. You may not show symptoms until 14 days after you have contracted the virus. Day 1 of the symptoms is going to begin with fever, fatigue, muscle pain, and dry cough. Remember, fever is spiking a temperature. Then difficulty breathing. Eventually, you'll be admitted to hospital, acute respiratory distress. After 10 days, if those symptoms continue, especially if you're over the age of 45 and you have past medical history, also known as comorbidities, you may be admitted to intensive care. After about 12 days, the fever ends and the shortness of breath stops. For those who are affected badly, then you may be looking at death after 18 days. After 2.5 weeks, you may potentially die from this horrible condition. This is why I encourage all of my colleagues, all of my relatives, all of my thousands of students, I tell them, even though you are young and you live with your mum and dad, your grandma and your granddad, doesn't mean that they will survive this horrible condition. Isolate, isolate, isolate. This is government mandated advice. Isolate. Now, ladies and gentlemen, understand that this horrible condition is the biggest pandemic of our generation. This will be talked about in years and years to come. There will be chapters written in the history books about this condition. Understand this, if you are a carrier of this infection and you sneeze, the coronavirus can survive in the air for up to 3 hours. It can survive on a copper surface for up to 4 hours. It can survive on cardboard for up to 24 hours. It can survive on plastics and stainless steel for 2 to 3 days. Wash, clean the surfaces of your home. Wash your hands regularly. If you develop a dry cough, if you feel feverish, call 111 and get some medical advice. Isolate, isolate, isolate. Thank you very much for taking the time to listen to my words. My name is Dr. Anil Sachdev from New Vision University. Thank you.